We've come to the end of this chapter, one final phase that's left, and that is the pregnancy and the birth of the child at the end of this huge, big, dramatic, dare I say, miraculous event that we call conception, fertilization, whatever you want to call it at the beginning, right through to the creation of the zygote, through to the creation of the embryo, to the creation of the fetus, to the growth of the baby in the womb, to the expelling of the baby out into the world, and then that baby having its cord cut, being an individual, taking its own first breath, and then growing from childhood through to adulthood, preparing for the next phase, which is the same cycle again, the cycle we call human reproduction. So we're going to finish this chapter today, and I'm going to start this by saying that there will be a test on this chapter on Thursday, so it's good that you start to prepare now. There are two little exercises at the end of this, which I'll tell you about when I get there, but just to refresh your memories, we've come to the stage of pregnancy. Now what's happened? What has happened is the ovaries have released an egg, okay? Or I should say one ovary has released an egg. And that egg is beginning to make its way out of the ovary and into the fallopian tube. Now, if sperm cells enter the female body and travel through the vagina, up through the uterus and into the fallopian tube as well, we will have a situation where fertilization will occur. If fertilization occurs, chemical messages are sent to the body in order to prepare the uterus to catch, for want of a better word, the zygote and the embryo that is about to enter the womb. So the womb lining doesn't break down in this case. In fact, the womb lining becomes very flush with blood, very, very good blood supply, therefore a good supply of oxygen and a good supply of food. And when the embryo comes into the uterus cavity, it embeds itself into the lining of the womb, and there it stays for approximately 9 months, drawing nutrients and oxygen from the mother and giving back waste products to the mother, so that the mother can at the same time get rid of the child's waste products as a result of the child's respiration. So just take a look at that in diagram 4. What exactly happens? Well, this is what happens. We have a situation where the egg, if you want to see it here, leaves the ovary. So let's just go back there again, sorry. Egg leaves the ovary, like from here. The egg travels into the fallopian tube here, and if it's a situation that there are sperm cells present here, now that marks the spot where fertilization will occur, okay? Fertilization always occurs in what we call the fallopian tube, all right? If fertilization occurs here, then what happens is that the zygote, followed by the embryo, enter the womb cavity, but they immediately implant. It's a very important word. They implant into the lining of the womb, where they will draw oxygen and draw nutrients from the mother's blood supply, and at the same time then pass back any waste products like carbon dioxide and urea and water and so on as a result of respiration. Very important to say that although the baby draws nutrients and oxygen from the mother and then sends back waste products, the baby's and the mother's blood supplies never touch. What they do is they simply come together like that. Okay, so you might the mother's blood supply, baby's blood supply, they interlink but they never touch. So we get a little kind of a movement across from the baby's blood supply to the mother's blood supply, and then from the mother's blood supply back to the baby's blood supply. And we'll talk more about that in a few moments. But that's how the whole idea of pregnancy begins. It's the fertilization of the fallopian tube, when the egg meets the sperm. So just here, the egg meets the sperm. There's one little sperm's made it all the way to here. When they meet in the fallopian tube, a zygote is formed. The zygote then becomes an embryo, and the embryo moves down here until it implants itself, and there it's going to stay for roughly 9 months until the child is fully developed and ready to take its own breath as a unique and precious individual. Okay, the embryo, as we said, continues to develop inside a membrane or a skin called the amnion. Now, as the child develops in a bag of fluid. One of the interesting things about that bag of fluid, that amniotic fluid, is that it has a very similar salt content to water. So there could be an evolutionary link there that we might look at later on when we're doing evolution. But it has, it's a liquid, okay, and the baby then is in a bag of liquid which we call the amnion. That bag is the amnion, and inside the amnion is the amniotic fluid. So you spent the first 9 months of your life in amniotic fluid, okay? And that's why when the baby is about to be born, that bag will burst and the waters will be released, which is called the breaking of the waters, and the woman then knows by the release of water that she's entered what we call the first stage of labour, and we'll talk more about that in a moment. So that's what it looks like. There's the amnion. The amnion is the bag inside which the child develops. Okay, so that's the amnion. And then you've got all this fluid around the child there, which, if you think about it, acts as a cushion. It protects the child. So if a woman gets an accidental bump in the stomach, whatever, the child will never feel it because the child is cushioned by water. So one of the actual functions of amniotic fluid is protection. Okay. After 8 weeks, the embryo is fully developed. Now, you can look this up yourselves, and you can go through some of the videos I have on these slides. But the rate of development over the first 8 weeks is incredible. By the time 8 weeks after fertilization has occurred, everything the child needs is already in place. Okay, just 8 simple weeks. It's only 2 months into pregnancy. Everything is there. What happens over the next 7 months? They just get bigger. They grow. They get ready for the birth process. That's all. So 8 weeks is what it takes for the zygote to become a fully formed, what we would say down here, fetus, or a fully formed small tiny little baby who now only has to spend the next 7 months growing, getting bigger, and waiting for the birth process. Pregnancy is the term given to the carrying of a developing baby in the uterus. It usually lasts for about 40 weeks, 9 months. Some people go before, some people go after. 40 would be an average. And during this time, the baby increases in size and in strength. Now again, I've got a video there to show you that process. So go back down to one of the Google Classroom entries and find the slides, bring them up and press that link and have a look at the videos that are there. They really are worthwhile. They do show you an awful lot of stuff that slides and words can't show. During this time, it must be nourished and be able to excrete waste products. Now, the mother is the source of the baby's nourishment. The mother is also the method by which the baby removes toxins from itself and gets rid of them away out of its own blood supply. But how does it do that? We know that the mother's blood supply and the baby's blood supply come very, very close together. And there's a special organ that is involved in bringing the mother's blood supply and the baby's blood supply very, very close together. And that organ is called a placenta. Okay? And the placenta is built, it's kind of built into the uterus lining. And what it does is it contains a tube that goes into the baby's belly button. So your belly button is basically where your cord was cut. So your belly button is the remains of your umbilical cord. It means that you were once tethered to a placenta inside in the uterus of your mother. Okay, that's exactly what it means. And what happens here is that the food and the oxygen from mam enters in here, crosses over into the baby's blood supply and is then delivered to the baby. And at the same time, the baby is going to make carbon dioxide and urea, and they have to be excreted. So they are sent back down through the umbilical cord, back out into the placenta and across into the mother's blood supply, where the mother then carries them to her lungs or her kidneys and excretes them on behalf of the baby. Okay, so it's a fantastic process to think that while the child is developing, mam is the source of nourishment and oxygen. Mam is also the means by which the baby excretes waste products as it respires, as it does from the moment of conception. The moment of conception, respiration starts, and it doesn't end until you take your final breath. So the placenta is an organ, and that's important. So it's an organ attached to the uterus that filters substances out from both the baby's blood and the mother's blood and passes them from one to the other through what we call the umbilical cord. Now that's the umbilical cord there. And as I told you, where the umbilical cord joins your stomach is now your belly button. That's the remains of where the cord used to be attached to you. Food and oxygen pass to the baby from mam, and then urea, carbon dioxide, water, and any other waste products that the baby makes and doesn't require pass from the baby to the mother. Alcohol, nicotine, unfortunately, and other harmful substances can also cross what we call the placenta and cause damage to the developing baby. So don't forget, at the very beginning, the baby is extremely fragile, okay, and very, very sensitive to drugs and narcotics and alcohol and nicotine and all that kind of stuff. So it's vitally important that in order to give the baby the best start in life, that over the first couple of months of pregnancy, a woman doesn't touch anything that can be deemed harmful to the baby. Now, there are things that we would say, medications that a mother can take that don't cross the placental barrier. They're too big to get into the baby's blood supply, so they only stay in the mother's body. But unfortunately, there are harmful substances like alcohol, nicotine, and other things that can get into the mother's blood supply, get to the placenta, hop over into the baby's blood supply, and then affect the baby's growth. So we've got to be very careful that to give the baby the best start, that we would remain free of any of these substances that may harm the child in the early stages of its development. So there you can see how close the mother's blood supply and baby's blood supply come together. But you notice there's a gap. Look, there's a gap there. There's a gap there. They don't touch. The mother's blood supply and the baby's blood supply are completely separate. They never mix, and in fact it wouldn't be a good idea that they would mix, because they could cause each other to have what we would say an immune response. That the mother's blood could try and fight the baby's blood, and the baby's blood could try and fight the mother's blood, and you get all kinds of complications. Okay, so it's a good idea that they don't touch. So they're separate blood supplies. However, they come close enough to allow food and oxygen from mom to jump into baby's blood supply, and then waste products like water, carbon dioxide, urea to jump from baby's blood supply to mother's blood supply. And that placenta, again, is a miraculous organ that allows that exchange to happen whilst mom and baby have two separate blood supplies. So after 9 months, what happens? We said already, for the first 2 months, the baby is busy putting everything in place, developing a brain, developing the eyes, developing the heart, developing the lungs, developing the stomach, developing the legs, the fingers, the toes, the nails. And after 2 months, they simply grow in size. So the better the baby is nourished, the healthier the baby will be at birth. Okay? Once the 9 months are over, the baby has to get out. The baby has now come to the stage where it needs to live what we would say independently, on its own, taking in its own nourishment and getting rid of its own wastes. Okay? And that process is what we call the process of giving birth. And the sign that birth is about to happen is a kind of a pre-birth stage that we call labour. And as I said there a few minutes ago, a woman will always know when she goes into labour when the little bag of fluid around the baby, the amniotic fluid, when that little bag bursts and the amniotic fluid begins to leak, the woman knows she's in the first stage of labour. Once that bag bursts and the baby drops down right down into the pelvic cavity, that then sends messages to the womb that it's time to push this baby out through the vaginal cavity and out into the wall. Okay, and what happens is you get huge, intense muscular contraction of the uterus that keeps pushing the baby downwards and downwards head first until the baby goes out through the cervix of the womb, down into the vaginal canal, and is delivered head first, shoulders, waist, and then the hips and the legs out into the world. The baby comes into the world still attached to the placenta. So now you've got the baby out in the world, but still pulling nourishment from the mother and trying to send things back. So what they do is they clamp the umbilical cord either side and they cut it. And when you've cut that cord, you have a unique and now independent individual that has to breed for itself, feed for itself, excrete for itself, and so on. In fact, all the 7 characteristics of living things, growth, reproduction, awareness, movement, feeding, excretion, respiration, they will all be present in this unique individual. So let's just talk a bit more in detail about them. Labour is the onset of giving birth. The muscles in the uterus contract strongly. So the uterus itself, the womb, is a huge big muscular bag that expands as the baby grows and then contracts when it's time to get the baby out of the woman's body. So they contract strongly and it causes the cervix to dilate. Now just if you were to take this as being the uterus, okay, just take this as being the uterus here, like that. The opening of the uterus there is called the cervix. Okay, so just the entry to the womb is called the cervix. So what happens is, as this begins to contract, the cervix begins to open, begins to dilate. So what happens, you'll notice, I'll try it here, is that it gets wide. Oops, that's my mistake now. It gets wider and wider and wider and wider to allow the baby out. So as these contractions are happening at the beginning, the reason for the initial contractions is to widen the cervix so the baby can be pushed out through it. Okay. The amniotic fluid is lost when the waters break, as we've said already. The contractions get stronger and more frequent until the baby's head is pushed out through the vaginal canal. When the body is delivered, the umbilical cord is clamped and is cut. Okay, now if dad is in the room as well, they normally turn to dad and they'd say to dad, would you like to cut your baby's umbilical cord? It's how the dad gets involved in the whole birthing process. Most dads will, some dads won't, most dads will. They'll take the scissors and they'll cut it, which is saying, yep, there's an independent new individual here that from now on will breathe for itself and feed for itself and excrete for itself and so on. So the baby will then breathe on its own for the first time. And sometimes when babies are delivered, they have become so comfortable in the uterus, not breathing for themselves, not feeding for themselves, not excreting for themselves, that they forget to breathe when they're born. And you might notice sometimes they're held up by the legs, give a little tap in order to give them a little bit of a shock to take their first breath. And once they take their first breath, those lungs will keep on filling with oxygen, the heart will keep on beating until the end of life appears and death stops both the lungs and the heart. The contractions will continue for another 20 minutes or so in order to deliver the placenta and the remains of the umbilical cord. So when the baby is pushed out and the cord is clamped and cut, the placenta is still attached to the uterus. So what normally happens is there are 3 kind of cycles of contraction. The first cycle of contraction is to open the cervix. The second cycle of contraction is to push the baby down and out. And then there are a third set of contractions which basically take the placenta, they peel it off the wall of the uterus and they expel it again down through the cervix, out through the vagina, so it's delivered. So you do deliver a baby and then you do deliver a placenta. And a placenta is quite a big organ. Again, you'll see it there in the video in that link. Okay, so there's the umbilical cord. You'll notice the umbilical cord is where the belly button will be. Okay, and it's clamped here and it's cut and the baby is now breathing for him or herself. There's a video, again, I can't play it to you here because I'm not going to play it for you, I'm going to let you watch it yourselves. If you take the slides from Google Classroom and just click on that video, it'll bring you through the whole thing. Okay. So what about the growth of the baby afterwards? So the baby's now delivered, okay? The baby has to be cared for. It's quite a helpless individual. Even though it's an individual, it's a very helpless individual. It has to be fed and washed and cleaned and dried and the whole lot for at least the first 5, 6, 7 years of its life before it starts to pick up forks and knives and stick them up their nose or in their ear, whatever they're going to do when they're trying to learn how to eat for themselves. But there's a lot of work involved in looking after a new baby. They are extremely demanding because they're growing at a rapid rate. Okay, you'll notice newborn babies, they tend to sleep an awful lot. That's because there's so much going on inside to get this baby to grow, all right, and put on mass in order to prepare itself for what we would say the toddler phase. Babies should feed on breast milk unless advised otherwise. Now look, if this baby has spent 9 months in its mother's body and its mother's body also has the ability to produce food, isn't it true to say that the mother's body will produce exactly what the mother's body knows the child is going to need? There are nutrients, there's immunity, there is an emotional bonding, which you cannot get from chemical bottled milk. No matter how good they tell you bottled milk is, it's a chemical that tries to replicate the effects of breast milk. There is no substitute for breast milk. Breast milk is the best milk. Okay, sometimes unfortunately that can't happen and then baby has to go on a bottle. Again, there's very little differences in the developmental phase later on, might be slight differences, but very, very little. But the best start you can give a child is the breast milk. Breast milk contains, as we said, nutrients, also contains antibodies, which will help the developing baby to fight infections. So babies who are breastfed at the first couple of months of their life are normally much more immune to picking up infections or getting sick or developing things like asthma and so on than non-breastfed babies are. Okay, it's just because the breast milk contains the best of all nutrients and antibodies and so on. Different systems in the baby's body become coordinated. The child begins to walk and wobble and fall and all that kind of stuff. They want to get going and they start shuffling around the place. After 1 month, the baby begins to hold up his or her head. It then begins to push itself up on its hands. It begins to turn in response to sounds. Baby may begin to make sounds of its own, so they begin to gurgle back or begin to laugh back at you or begin to recognize you and smile when they see you coming or waving their hands when they get excited. Teeth will emerge from the gums at about 6 months of age. So some poor children go through a very difficult teething period. Their gums are sore, their face is red, their earaches are just 2 earaches a day. They just get a very hard time of it. It's no joke. The gums are rupturing to bring up teeth. So it's a difficult process. Some babies sail through it. A lot of babies find this a very, very difficult period. So you've got to get medications to try and get rid of the pain and help them to sleep and so on. Baby is weaned from milk and can eat solid foods within a year. So you try to introduce the spoon. Mashed food, maybe little bits of potato or what we would call a soup dish. Put soup in with potato and make sure that it's kind of good consistency, not too lumpy because they still can't mash up their food properly, so you got to mash it for them. But you introduce them to the solid food to try and wean them off the milk only. Babies will begin to walk at about 1 year old. They'll try to start talking, dada mama, the usual thing. They continue to develop until puberty hits. Now, when does puberty hit? Whenever the child's body receives the signal. It's not that it has to happen at 12, it has to happen at 9, it has to happen at 14. It will happen when the brain turns on the signal to send the message down to the ovaries and the testes to produce estrogen in the case of a girl, testosterone in the case of a boy, to begin the hormonal cycle of puberty. So it's up to the brain whenever that wants to happen. Some people it happens early, some people it happens later on, but it's the brain that controls, not a textbook. Okay, so sometimes we said already, for many reasons, a married couple may decide to postpone a pregnancy. So they mightn't be ready. They mightn't feel that they're ready to bring the child into the world. Maybe they feel that they're not in the right place, or in terms of having enough rooms, or they might feel they're not financially ready. There's an awful lot of reasons why people might delay in bringing a child into the world. Good knowledge of the menstrual cycle provides information on how to recognize non-fertile times. Now, we've had this, okay? And we've said already that there are 28 days on average in the menstrual cycle. We go from 28 to 1. We go from 1 down to about 11, 11 to about 15, and then from 15 back to 28, okay? Here's what you've got to remember. Between 11 and 15 days, that is the fertile time. So if intercourse takes place from, say, 10 days up to 16 days, the chances of becoming pregnant are very, very high. If intercourse takes place closer to day 1 or closer to day 28, the chances of a pregnancy occurring are very little. They're not zero, but they are less than would be the case if sperm cells were present in a woman's body in and around days 10 to 16. Okay, sperm, as you know, live for 3 days, so about 10 to 16. We normally say between 13 and 15, they're the days when the ovary will release the egg. Okay, so between days 13 and 15, that's when ovulation takes place. So therefore, if you're not desiring a pregnancy, well then there should be no sperm cells in the uterus between the days of 10 and 16, maybe a little bit beyond that. If we are looking to start a family, then sperm cells should be present in the uterus and in the fallopian tubes, especially around the time of ovulation. So the people have to time it, and they've got to make sure that they time it correctly so that the chances of fertilization are kept quite high. Intercourse during these non-fertile times has very little chance of resulting in conception. Not a zero chance, little chance. Since it is based on a natural cycle, it is known as natural family planning and has no side effects. So therefore, if parents wish to space their children, the best thing to do is for the woman to get in touch with her menstrual cycle and have an idea as to when ovulation occurs month on, month on, month on, month on. So when she has an idea, a very good idea in her head as to where an ovulation is going to occur, then she'll make sure there's no sperm cells there to fertilize the egg. Otherwise, pregnancy will result. Okay, so there's a mathematics behind it. There's a calendar watch behind the whole thing to make sure that if we wish to space children in a family, then the best way to do it would be the natural family planning way, because there's no side effects, no chemicals involved. It's just a rhythmical watch of your own biological messages. Along with the natural method, there are artificial methods. So there's the estrogen pill or the implant. That's the estrogen pill. It contains the hormone estrogen, and estrogen was able to block the fertilization, it's able to block the egg being released from the ovary. So the ovary doesn't release the egg when it should. The condom obviously prevents the sperm cells from getting from the male body into the female body, puts a barrier between the two. The diaphragm, another barrier, but it's in the woman's body this time, and stops the sperm from getting into the uterus. But none of these methods are 100% effective. Okay, but that's none of them. Even the natural family planning method is not 100% effective because it involves maths. All the rest of them are based on chemicals, or they are based on physical barriers. Physical barriers can break. Chemicals mightn't be received properly, it mightn't be absorbed properly, or mightn't be taken at the right time. So there's, again, people have to be very, very careful, no matter what method they're using to space children, that they do so properly and they do so with great, great care. The problem with the chemical ones, like the estrogen pill or the implant, is if they're used for a very, very long amount of time, they may have physical side effects. Okay, when they're being used to maybe to regulate, some people, and they're in their very early years, normally would take small doses, very, very slight doses of the estrogen pill to kick the menstrual cycle into some type of regularity. That's perfectly fine because the dose is tiny. It's only when these have been taken over a very long amount of time that there's a little bit of evidence that maybe there might be certain physical side effects that are associated with them. Of course, the best way to avoid conception is obviously abstain from intercourse. So if you don't want to get pregnant, then you simply don't have sexual intercourse. That means that there's no sperm cells present there in order to fertilize the eggs. That's 100% effective. So how do we prevent implantation? Now, this is a kind of a very dodgy ethical area, okay? Preventing implantation means that the zygote has already been formed, and the zygote becomes the embryo, and the embryo then is prevented from getting into the uterus lining where it needs to burrow down and grow for 9 months. So there are ways by which we can stop that little embryo from being able to make its way into the womb lining, and what happens is it's simply passed out of the woman's body. Now, there are serious ethical implications, okay? Roman Catholics believe that from the moment of conception, from the moment that the sperm cell and the egg cell meet and the zygote is formed, that is life. And for the Roman Catholic Church, life from that moment onwards, right through until the time of physical death, needs to be respected and needs to be protected. Okay, so they're the two things they believe. So a lot of Roman Catholics would have a difficulty if they were trying to prevent implantation, because the child is already in place, the zygote has been formed, but it's not been given a place to lodge and develop for the 9 months. The methods of artificial prevention include the IUD. It's a coil. Now, what the coil basically does is it just continuously scrapes the side of the uterus lining and doesn't allow that layer of blood vessels to build up to give nourishment to the growing zygote. So the zygote and the embryo come down, there's no womb lining there, nothing to embed into, so it's simply passed out of the woman's body. Or the emergency contraception pill, which is a large dose of a hormone, which basically tells the uterus to expel everything. Okay, so again, these are methods that are used after fertilization has taken place, and there are questions over it for the very simple reason that there are ethical considerations at the fact, well, if life is already present in the zygote, what are we doing if we're telling this life that it can't embed itself into uterine lining? Okay, so there is the what we would say pre-fertilization contraception, and then there is post-fertilization preventing of implantation. Now, I know the terminology is a bit heavy, but pre-fertilization contraception, and then if conception has taken place, there are steps to be taken that can stop that little zygote, that little embryo, from implanting into the womb lining, where it normally does for 9 months, but instead tell it can't embed itself, and it's simply passed out of the uterus and out of the woman's body. So what I'm going to ask you to do, that finishes that section. There are 2 quizzes here. Again, go to the slides on Google Classroom, get into these quizzes, go down through the quizzes, make sure that you understand the terminology that's involved. But this time what I'm going to ask you to do is when you finish each one, I want you to take a screenshot of the final screen when you're finished both exercises, because on that screen there's a little percentage score. Okay, so when you've done this test here, got to the end, I want you to take a screenshot of the last one and upload it to Google Classroom. And likewise, when you get to the pregnancy matching quiz, go through it. When you get to the last screen and you've got your percentage, I want you to take a screenshot of that, and I want you to put it in Google Classroom as well. Okay, today's Tuesday. That section is finished. You have 2 days. Thursday you'll have a test on this section. All right, and I will be examining everything right back as far as human reproduction, right back to the very start of these slides until the end of today's class. So I'm going to ask you to pause or click on these links on your slides. I'm going to ask you to do the exercise now, and then upload please a copy of those 2 when you're finished, particularly the end slide that has the percentage that tells me exactly how you've got on with that exercise. And if you have any questions in preparing for the test on Thursday, you know where I am. Send me an email. If you need any help whatsoever, or you need something explained again, just send me an email, let me know what it is, and I'll get you back the help that you need.